Members, it's now time to vote on the claims for improvement of your wages and conditions for the next Public Health System Award. The claim we are presenting to you is the result of research, analysis and democratic processes, the final two of which comprises a committee elected from the Public Health System delegates and the Council of the Association. The Log of Claims Committee was unanimous in its conclusions that we should pursue improvements to ratios delivered by minimum mandated nursing hours in major metro, non-metro, district, community and multi-purpose services across the state. To establish ratios for emergency departments, paediatrics, neonatal and critical care areas, both adult and paediatric. To expand ratios in mental health and establish a ratio-like system of maximum face-to-face hours for community and community mental health. The committee also took a pragmatic approach to the pay claim and decided that we should claim 2.5% for 2 years to match inflation and ensure all our efforts are focused on improving safe patient care and therefore improved working conditions for nurses and midwives. So let's hear from members of the Claims Committee and your council.
I'm really excited about this campaign because ratios puts patient safety first.
It's about fairness and equity and about rolling out ratios to those that we haven't already been able to achieve a good ratio result.
The committee are very focused on achieving ratios and becoming a world first union in getting ratios in sectors that no one else in the world has got.
Our ratios are important to be maintained within our system. They need to be embedded within the system and it's important for the community, nurses and also our country colleagues.
We definitely need ratios in small country areas and even in the larger hospitals they're becoming more and more important.
The more nurses we have, the better effective care we can provide people out in the community, in our hospitals.
We need to maintain those ratios as well as work on enhancing the ratios, especially around the remote and rural areas that need more improvement at their work facilities. There's a lot of work to be done yet.
This claim is important to me because it will improve the staffing ratio for all nurses working in emergency to be able to provide appropriate and safe care to the patients that come into our departments.
I think the 1 to 3 in ED is really important because it's going to allow us emergency nurses to provide safe patient care.
For community mental health nurses is an excellent opportunity for us to now be able to divide our workload into the face-to-face time that we spend with our patients and also to be able to allocate time to do the other roles that we have.
That we're the ones that are out there to help them once they're out of the hospital and for looking at primary health care. Ratios for us is really important, especially with what our workloads have been like for years.
It includes areas such as the critical care areas, intensive care, high dependency units, emergencies, community health, community mental health. All these areas need to be improved as well.
To ensure that every person receives best practice and safe as possible.
We are going to fight for this campaign because we are focused on ratios.
Vote yes to support this campaign.
Vote yes for this one.
Vote yes. Vote a big yes.
Vote yes, vote yes.
Vote yes.
Vote yes, vote yes for this one. Vote yes.
Vote yes.
Please vote.
Vote yes.
Vote yes.
Vote yes.
Vote yes.
Vote yes! Vote yes!